Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, in this episode, I would like to go over certain signs that you may have an abdominal problem. And these signs tend to be overlooked a great deal, especially when it comes to its direct connection. Because some of the symptoms that I'm going to discuss, you may experience, and you may tie it to something else, and ignore seeing an acupuncturist or even a physician because you've misdiagnosed the cause. So understand that, because abdominal problems, there's so many, there's a wide variety of abdominal problems that can be considered either organic or acute or even chronic. But it also depends on underlying health issues or even a specific organ that's affected. And this is why it's important, along with seeing a physician on an annual basis, you visit an acupuncturist for regular wellness sessions throughout the year. Because it's all about your health. That's what it's all about. Because if there's no health, poor health, there's no happiness, there's no you. And that's what it comes down to. With time and over time, we've become so disconnected from ourselves that we put technology and other things first. And we begin to abuse this wonderful temple for which we exist, and that's our bodies. Our health, our overall health suffers. That's why I say over and over, it's important to see an acupuncturist throughout the year for regular wellness visits. And it doesn't have to be every week. It can be every other week. It could be once a month. It could be at the beginning of every season. Okay, but when it comes to abdominal issues, one of the first signs that should ring an alarm is pain. And now abdominal pain can come in different types. It can be generalized, it could be localized, it could be continuous versus cramping, high intensity versus low intensity, chronic versus acute. But more times than not, abdominal pain, it can be short-lived, it can be self-limiting due to various causes. And I will say, abdominal acupuncture is great for treating problems associated with the abdomen. And it's why I say, see an acupuncturist. Because sometimes this pain, abdominal pain, can be urgent, and it may require immediate medical attention. Get to an acupuncturist right away. And if you need to be referred to a physician, you would be. But focus on how long the pain hangs around, because you will be asked that. And some individuals will see an acupuncturist, sit before an acupuncturist, and they'll guess, but, maybe not. But now, pay attention along with whether the symptoms subside or not. Are there other symptoms that are occurring simultaneously? Like, are you experiencing a high-grade fever or severe chest pain or problems with breathing? Is there abdominal swelling or nausea or severe diarrhea or vomiting? Because again, abdominal pain, along with other symptoms occurring at the same time, this can be serious. See an acupuncturist right away, and if you need to be referred to a physician, you would be. Because again, I'll reiterate, abdominal pain can be short-lived, it can be self-limiting. Why? Because of, let's say, you're just suffering from constipation for the moment, which is a sign that there's something wrong, or indigestion, or intestinal gas, menstrual pain, or something you ate. Now, let's just say if there's swelling, I'll say right off the bat when it comes to that, this can be associated with heart problems. If you're experiencing swelling of the abdomen, and there's this outward projection, there's a good chance you may be referred to a cardiologist, but I'd recommend you'd see a medical doctor right away. Now, it can be accompanied with pain. There'll be some discomfort or this sense of feeling bloated. Now, when you're feeling, if there's a sense of feeling bloated, again, this can be a sign of a serious medical problem. Now, it could be self-limiting due to indigestion, constipation, weight gain, intestinal gas, and even menstruation. But let's say if you see a physician, like I recommend on an annual basis, right? They may check you for, like, if it's due to feces or fetus, fluid, gas, fat, foods, fevers, or flaccid abdominal wall, and even functions of abdominal organs. A physician would check for that. Now, when it comes to swelling, though, it can also be due to, let's say, tumors or obstruction of the intestines or buildup of blood and fluids, or even a ruptured organ or blood vessels. Failure of vital organs, or severe infections, or an autoimmune disorder, or some type of inflammatory disease. Abdominal problems is not something you should take lightly. Because to an acupuncturist, this is a sign that that middle jowl, which I speak of a lot, which consists of the spleen and stomach, has been affected. And when there's a dysfunction of the functions of the spleen and stomach, anything goes wrong. Think of it this way. There's going to be problems with the production of both chi and blood. Hands down. See an acupuncturist right away. Now, if you notice if the swelling doesn't go away, and there's vomiting and loss of appetite, diarrhea, fatigue, weakness, chest pain, high fever, difficulty breathing, seek emergency care immediately. Especially if you notice, let's say, when you use the restroom, there's blood in your urine, or blood in your vomit, or blood in your stool. This is serious. This can be a sign of internal bleeding, some type of obstruction, or tumor, or trauma, infection, inflammation. Now, a person can use the bathroom and they can have blood in their stool or urine, and you may not notice it by just looking at it. But I tell you this, if you ever notice just by looking at it that there's blood in your stool or your urine, you seek emergency care right away. All right, because hematuria, which is blood in your urine, it can be due to a UTI, let's say urinary tract infection. It could be due to cancer of the kidneys or bladder, or you could have injured your urinary tract, or it could be due to kidney stones. Even in men, prostate. It could be due to a clotting disorder, or a genetic kidney or non-kidney related disease. And that's just a few reasons as to why you can experience hematuria. Hematuria, again, is blood in your urine. But now when it comes to blood in your stool, this can indicate some type of bleeding in the gastrointestinal system, your GI tract. And that could be due to, let's say, anal fissures or inflammation or infection of, an organ such as your colon or your stomach. It could be due to varicose veins or abnormal blood vessels, polyps, ulcers, cancer, especially colorectal cancer. Now, colorectal cancer is considered the leading cause of cancer-related deaths. Now, if you notice blood in your vomit, that's another sign, indicator that there's something seriously wrong. It's a serious abdominal problem. Seek emergency care right away, and then see an acupuncturist after that. And a lot would have to do with the volume, the frequency of you vomiting, the density of blood that's found in your vomit. It could be due to a large variety of problems, such as ulcers in the stomach or even in your intestines, swollen veins in the stomach or your food pipe, or tears or swelling in the digestive tract, inflammation, or even an infection in the GI tract. Now, you have individuals that take anti-inflammatories or painkillers a lot and for an extended period of time. That can injure the abdomen. Please be aware of that. If you're taking anti-inflammatories or any type of painkiller, see an acupuncturist. That's who you should be seeing. You shouldn't be taking anti-inflammatories or painkillers. See an acupuncturist. But blood in your vomit also can be due to injuries of the abdomen or cancer of the stomach or even pancreas. Many individuals are unaware of that. Because you have to keep in mind, health is wealth. I say this over and over. It's not in an app on your phone. It's not in the stock market. It's not in the bank. It's not in the safe. It's not in your pocket. It's not in your purse. The wealth is not under your mattress or under the doghouse in the backyard. And it's not in the shoebox in the closet. The wealth is in you. That's where the wealth is. It is in you. And I'm sure that's why most of you listen to Acupuncture's My Life podcasts. Now, another sign can be diarrhea or even constipation. there's something wrong with your abdomen. And these are common symptoms. And they're usually associated with, when you're experiencing diarrhea or constipation, it's usually associated with something you've eaten, or are you taking antibiotics or antacids, which you should not be. Well, antibiotics, yeah. Yes and no. I mean, it may be required, but antacids, see an acupuncturist. Diarrhea or constipation can be due to taking pain medication or different types of supplements, junk food, artificial sweeteners, or even just having a diet that's lacking fiber. Or are you eating too much in the way of spicy foods? Or you're dehydrated because you're not drinking enough water? See an acupuncturist. Okay? And if this diarrhea or constipation lasts longer than, let's say, like 2-3 days, and it's accompanied with other symptoms such as abdominal pain, vomiting, incontinence, weight loss, blood in the stools, blood in your vomit, blood in your urine, or severe dehydration, you want to seek emergency care right away. And see an acupuncturist. Okay? Along with seeing an acupuncturist after emergency care. You see, when it comes, let's say, to diarrhea, right? An acupuncturist understands, one, that exterior pathogenic factors can cause diarrhea. Especially like, cold weather, or if you're in a damp environment, even heat. It can also be due to, let's say, improper diet as a result of overeating that impairs digestion and absorption by the stomach, or eating too much in the way of cold, raw foods or contaminated foods. These things can injure a person's spleen and stomach and impair the ability to transport fluids and foods. And it can affect the ascending as well as descending aspects of chi. Because the spleen to an acupuncturist sends chi up, and the stomach sends chi down. Now, emotional stress can cause diarrhea too, because it tends to stagnate the chi of the liver. And emotional stress, let's say, caused by anger, long-term frustration, and we speak about this at acupunctureismylife.tv, holistic health panel, discussing how mental and emotional problems can cause disease. But excessive anger or long-term frustration tends to overact on the spleen, leading to spleen chi deficiency, and can impair the function of transformation and transportation of foods and fluids. So there you go, your digestion is affected, and an acupuncturist will pick this up. Diarrhea can also be as a result of deficiency of the spleen and stomach due to, let's say, overexertion or irregular diet over a long period of time, meaning eating bad foods. Chronic illnesses can also exhaust the spleen and stomach and cause diarrhea as well. Okay? And these are things that your acupuncturist will sit and discuss with you. Yang deficiency of the kidney. The yang aspect of a person's kidney can cause diarrhea if it's deficient. And what depletes the yang aspect of a person's kidney can be chronic illness such as diabetes or high blood pressure, COPD, age also. Because when the yang aspect of a person's kidney is deficient, it tends to impair the spleen's function when it comes to digesting and absorbing nutrients. Now, when it comes to constipation, now what can cause it? As an acupuncturist understands, one, it can be due to constitutional excess of yang. Now, this is why I say acupuncturists treat every patient that walks into their office differently. There's never a one-size-fits-all type of treatment, because we're all born with certain deficiencies, certain excesses. Everyone's different. And these deficiencies and excesses in which we may be born with can affect our health throughout life. Now, in this case, like I said, with constipation, it can be due to constitutional yang excess, which leads where you can see like accumulation of heat in the intestines and in the stomach as well. And what else can cause constitutional yang excess? Overindulgence in alcohol or sweet and spicy foods, which creates, again, a large amount of heat in the stomach and the intestines. Now, constipation can also be due to chi stagnation. When someone's worrying all the time or depressed, again, watch acupunctureismylife.tv. There's so much you would learn about mental and emotional disorders. What else can cause this chi stagnation? Lack of physical activity, which tends to affect the transporting and descending functions of chi. That's why I do so many podcasts discussing the importance of exercise and being active. Because if your lung chi does not disperse and descend, it'll affect the flow of chi in the large intestine, and boom, constipation. That's why exercise and being active is important. What else can cause constipation? An acupuncturist understands chi and blood deficiency. Because when chi is deficient, that ability for peristalsis to move the feces through the large intestine becomes inadequate. Now, when blood or even yin and essence are deficient, there's no lubrication of the intestines, and then there's dryness. You can't move your bowels then when there's dryness. What else can cause constipation to an acupuncturist is yang deficiency with internal cold. If internally you're feeling cold, you have an aversion to cold, then yang is deficient. What can cause that? Chronic illness, age, certain types of foods or herbs that are cold in nature. And guess where it'll accumulate? In a person's intestines and stomach. And understand something, cold tends to congeal the flow of yang qi and fluid in the intestines, making it sluggish, and boom, constipation. And since I spoke on vomiting can be due to a myriad of things. An acupuncturist understands exterior pathogens can cause that. Because epidemic pathogens tend to have a direct influence on a person's stomach, and therefore it'll hinder the descending functions of stomach chi. Remember I said stomach chi goes down, spleen chi goes up. causing a person to vomit. Now, improper diet can cause that too. Let's say excessive consumption of raw foods or foods that are cold in nature, greasy foods, contaminated foods. These types of foods tend to injure the stomach and affect the spleen as well, causing food to stagnate. And now when you prevent stomach chi from descending, it's eventually going to rebel and ascend, and that's not good, and you're going to vomit. And acupuncturist also understands that emotional stress, here we go again, can cause vomiting. Anger, frustration. Guys, watch acupunctureismylife.tv. There's so much you would learn. Emotional stress, again, has a direct effect on a person's liver, which hinders the free flow of chi throughout the entire body. Why? Because stagnant liver chi tends to overact on the stomach and cause a person to vomit. Other mental issues or emotional issues such as pensiveness, excessive worry, can impair the function of the spleen's ability to digest food as well as fluids. And these undigested foods and fluids sitting in the stomach now is going to go up and come out vomiting. Also, deficiency of spleen and stomach. This can be due to constitutional deficiency or overexertion and chronic illness, which exhausts the yang aspect of a person's spleen. Now the spleen is unable to extract essence from foods and liquids in which you drink. Boom, vomiting. It's important that you sit with an acupuncturist. There's so much you would learn about the yin and yang aspects of your body. Nausea as well. It's another common symptom. Acid reflux, overeating, gas issues, indigestion. Nausea can also be another indicator of serious abdominal problems such as ulcers, cancer, and obstructions in the GI tract. Now, if you're feeling nauseous and you notice you're having trouble swallowing, fever with difficulty breathing, emergency care is super important. It's all about your health. That's what it ultimately comes down to. But if you ever notice you're experiencing some of these symptoms, don't take it lightly. Don't try and go and buy some over-the-counter drugs to mask it. See an acupuncturist right away. And simply just make acupuncture part of your life. Because acupuncture is my life. What's yours?